Okay, great. So thank you, everyone, and good morning. This is Kate Gooden with Maricopa County Department of Public Health, and thank you for joining us for our last of 4 webinars around the strategic directions for our strategic plan surrounding climate change and health. Today, we are going to be discussing promoting public education about climate and health. Sorry, we're having a technical difficulty. Let's see. Okay, so this may be slightly repetitious for those of you that have attended the previous 3 webinars, but we do see that we have some new attendees, so we are going to go over a few of the background pieces about how we arrived here with these strategic directions and with what we're presenting to you today. So we're going to give you an overview of how we went through that planning process, go over the 5 strategic directions identified, and then spend some time going in depth over promoting public education about climate and health. We are going to hopefully recruit many of you to be part of our action teams, and we're going to tell you a little bit about what those are, and then we're going to update you on our 5th direction that did not receive its own webinar, which is celebrating success and champions. So again, today is the last of this series of webinars. These are being recorded and are available on our website. Currently, the first 2 webinars are available there, and then these 2 will, the last one and then this one will be posted at the end of today. Here is a look at that website. It hosts a lot of our information about the plan, about how we arrived here, about partner organizations. It was launched back in 2018. It's listed here on our main Maricopa County website, and you can access it through any of those tabs at the top, so providers, schools, community, or individuals. It also has a link on that same page for our Climate and Health Champions Recognition Program, which again, we'll go over at the conclusion of the webinar. So how did we arrive here? So many of you might have seen or attended some of our meetings called Bridging Climate Change and Public Health. The stakeholder group had met twice, with the last in-person meeting being in May of 2017. At that time, our goals were to identify trusted community conveners around climate and health topics, identify barriers to climate and health work, and identify coalition-related barriers and facilitators to ensure that bridging climate change and public health as a group would be sustainable. So if you were at those meetings, you participated in some feedback sessions, and we used that feedback to then determine our next steps. So based on that information, we really felt like it was prudent to convene a smaller work group to really focus on a strategic plan. And again, part of that was to provide direction for the group, to provide a clear mission and vision for the stakeholder group, define the scope of that group, and then really focus on sustainability for this coalition, because we all know that that can be definitely a challenge for many of these kind of multi-sector groups. We had a professional facilitator walk us through the strategic planning process. It was a relatively long process. We went from June through December of last year, and we have our draft plan, which is in the process of being reviewed and should be ready for you all in the stakeholder groups very shortly. Here are some of the groups that participated in that strategic planning process, and we really want to thank them for their time, for their input, and we really hope that you think that their time was worthwhile and that this strategic plan is going in the right direction. So the 5 strategic directions that we identified through that strategic planning process are celebrating success and champions, which is an opportunity to raise awareness of current activities and successes across our community, really focusing again on climate and health interventions and mitigation strategies, and we'll talk a little bit more about that at the end of the webinar, like I mentioned. The second one is building community awareness through a strategic and targeted communication plan, which is really meant to support reasonable and unified climate change and health messages so that we're all speaking with one voice. The third one is fostering environmental action for a healthier community, which is really intended to promote individual and organizational movement towards implementing mitigation and adaptation efforts. So providing that suite of activities that can then be used within the community, regardless of which type of organization or individual you are. Really, again, kind of trying to provide that support for the community. Coordinating research and collaborative efforts to catalyze change, which is the fourth strategic direction, which is really meant to support this idea of breaking down silos between research and implementation so that we can really have meaningful results that are practice-based, that are really truly relevant to our community issues, where community members want to go, and then providing that evidence base. And then the final one that we're going to be talking about today is promoting public education about climate and health. So this is really targeted to providing resources for education in the private and public sector, which are grounded in current science. So again, providing more of a support mechanism for organizations or individuals that are interested in implementing educational efforts around climate and health topics. So for each of these strategic directions, we have identified an action team lead and co-lead, which again, we'll talk a little bit more about what it means to be on an action team later. But for today's strategic direction, our lead and co-lead are David Hondula and Lucy Flatten. And they will take it over from here. David, I heard that you're on the line.
Hi, Kate. Good morning. Hello, everyone. Thanks for joining in. And Kate, thanks for the opportunity to lead our discussion this morning. And I do want to emphasize, as Kate says, that this is an opportunity to grow a conversation and join in the process here that the county and collaborators have facilitated over the past several months. We are certainly welcoming input from all of those joining in and your networks beyond the meeting attendees. Next slide, please. Just to briefly introduce ourselves, as Kate alluded to, this is very much a team effort. You can see some of the group here that's been participating in the strategic planning process. I'm Dave Hondula. I'm a faculty member at ASU in our School of Geographical Sciences and Urban Planning. And our co-lead for this theme is Lucy Flatten from the Citizens Climate Lobby. Unfortunately, she is not able to be with us today. Lucy has a background in higher education, healthcare, and nursing. She served on the nursing faculty for Maricopa Community Colleges. And I think it's quite a nice situation that we have two educators who are involved in the educational thrust here. Next slide, please. As Kate mentioned, the goal that's been established through the strategic planning process is to support and promote education. And our discussions have been very interesting, thinking about what we mean by climate and health. And we think that there are opportunities for education related to climate, health, and the intersection of climate and health. And that's probably where this group and this initiative has the greatest potential to add value to what is out there in the community right now. But we are also aware that we need to be at least involved in trying to understand what's happening, both from a climate education perspective and from a health education perspective, before we can really engage with the intersection of these two topics. You might have seen somewhere that the mission for the Bridging Climate Change and Health Initiative is for adaptation and mitigation of climate-sensitive hazards to improve health. And we see the role of the education thrust here as empowering residents to be able to participate in those adaptive or mitigative activities, or at least be able to participate in or appreciate the conversation around those activities in Maricopa County. Next slide, please. The strategic planning group tried to assess the current situation and challenges related to public climate and health education in Maricopa County. And these were some of the barriers or challenges that we thought we might be up against in trying to improve public climate and health education. We think there's a very wide range of potential actors that span both formal and informal educational settings. We are aware that there's conflicting information and messages, both from a climate perspective and a health perspective, and a little bit at the intersection of climate and health, although frankly, we're not sure exactly how much education is happening at the intersection of climate and health. We know we're up against preconceived notions and entrenched attitudes about these topics. There's unknown content in formal curricula, and when we think about the K-12 sector in particular, there's limited flexibility in how formal curriculum might be modified with the necessity to adhere and meet state standards. We see climate and health as an emergent topic, which might have slow institutional uptake. There's only over the past few years have we really seen a wave of information coming online, various federal grants and other programs that are specifically targeting climate and health. Our group was not familiar with any opportunities for continuing educational credits or other certification programs that might exist for medical professionals or other health professionals. And we are not sure what the latent public interest, awareness and demand is for this topic, although we are hopeful that there is some latent interest out there that we'd be able to capitalize upon. Next slide, please. We've developed a couple of strategies that we'd like to move forward with through this group, and of course with your input as well. The primary activity we'd like to conduct, at least over the first year, is some type of landscape assessment where we'd really like to understand what is happening both from a formal and informal education perspective in our county related to climate and health. And this might involve inventorying programs that are happening at community centers and libraries, trying to understand where state standards are at least relevant to topics of climate and health. Perhaps there is material that's being taught in K-12 schools at the intersection of climate and health. We'd like to learn what those programs are, and at the higher education level as well. What are the courses, programs, disciplines, certificate programs that are relevant here? As Kate mentioned earlier, we recognize that the small group who will be involved in this in this work will not be able to educate the entire population of Maricopa County about climate and health, nor do we think we are the appropriate people to do so. Instead, we see a support role where we can empower formal and informal educators to take on some of these topics as they are interested to do so in engaging with the communities that they know best. That being said, I think the people who are involved with this work group do have the opportunity for direct education. I think we can be out there ourselves, leading and attending community meetings, making classroom visits, and so on. So I think we can be hands-on to some extent moving forward. Next slide, please. Here are some goals that our work group identified for the first year. We thought we could take on an assessment of climate and health content in Maricopa County K-12 schools, and perhaps with a pilot in higher education, leveraging our connections with ASU and otherwise. The group established a goal of completing this assessment for something like 50% of the school districts in Maricopa County over the first year. Well, we know we need to review the K-12 standards in the state of Arizona, and we think we can identify points of alignment where climate and health topics fit into the existing standards and structures. We'd like to inventory exemplar courses and programs that exist wherever they may be around the world. The screenshot you can see there on the left-hand side, or your right-hand side of the screen, is one type of online program that's been developed related to climate change and health, offered through the nextgenu.org portal. We suspect that there are more programs like this out there, and we'd like to understand the motivations behind creating these programs, who has been creating these programs, why, what attendance has been like, what the content is like, and if they think they've been successful. We would like to explore partnership opportunities for continuing educational credit types of courses. We'd also like to explore options locally for hosting a repository or online library or database where educational resources that we may create or come to learn about could be curated. And that may or may not be best housed at the county health department. I think that's a topic for open discussion, but we do think, and we see examples elsewhere in K-12 and higher education, that online repositories for teaching modules can be very helpful. And a particularly interesting idea, in my opinion, that the group came up with was to create a speaker list where the county health department or another entity would manage a list of known contacts in the community that can go and speak to community organizations, schools, visitors to the area about topics at the intersection of climate and health. And we would need to figure out, and we would propose in the first year to develop this list and develop some type of management system where requests could be made, and we could ensure that the contacts were receiving interest from parties, and also keep track of what the engagement is like with this system, so we're able to document project success. And speaking of success, on the next slide, as we look toward the future, here are some potential indicators of long-term success. These, some of these can be measured in the short and long term. In the short term, we can imagine the presence of certain lesson plans or modules. Over the long term, can we imagine the creation of particular courses or even modifications to state standards? Open question for this group. We could certainly see improved visibility in community and professional meetings of topics at the intersection of climate and health. It should be relatively easy for us to measure traffic on relevant websites, the number of credits that are earned through continuing education programs or perhaps university courses. We could keep track of the number of requests for speakers and the activities that these speakers are doing through the speaker list. And then softer goals that will be tougher to measure, but that we are ultimately are seeking, are some type of coordination of the educational curriculum for climate and health across scales and levels, imagining a pipeline by which K-5 students transition into secondary and high school and then post-secondary school, and even on into professional education, where there's some consistency to the experience here in Maricopa County, or at least some awareness of what's happening at these different levels. And of course, most importantly, to improve the knowledge in the workforce and population at large here in Maricopa County. And we think that's not just for the health sector or the climate sector. I think we're trying to target as wide of a swath of the population as possible. And I think that is the last slide that introduces some of the ideas that we've had in our working group thus far about promoting climate and health, public climate and health education. And we are hoping that you can help us flesh out these ideas even farther. As Kate mentioned, we'll be forming action teams that will be where this work gets done over the next several months, years, and on into the indeterminate future. We are looking for 10 or 15 members of the action team that would attend a once-a-month meeting that might last an hour or two, and would of course help complete necessary tasks between those meetings. I'd like to emphasize that there will be opportunities for ways to be involved in a small way or a big way, and of course we'll recognize that people have varying availability and commitments throughout the year. If you feel like you'd like to contribute but can only do so or only want to do so in a small way, don't be discouraged from expressing your participation. We recognize that this is a huge and messy topic, and we certainly need a diversity of ideas and many ideas to feel like we can really make progress in this direction. There are instructions here on the slides on how you could sign up. You're certainly welcome to contact me with further questions, or Lucy as well, and the centralized email address for the initiative is here. And with that, I'll be happy to yield the floor back to Kate, who is going to tell us, I believe, about one of the ongoing other initiatives related to this work.
Thank you, David. If people have feedback or questions about this strategic direction, feel free to speak up on the line, or you can always type your question into the chat box, which is part of the GoToMeeting. Do we have any questions for David at this point? Well, we will give you a chance again in a little bit, so keep thinking about that. We really want to emphasize that any of these strategic directions are still in their draft format as far as the actions and activities that are ongoing as part of these, as well as the goals that are identified. So we really would like for you to provide any sort of relevant feedback that you might have or ideas, and that will be an ongoing evolution during these action team meetings. So again, if you really feel called to be a part of one of these action teams, we would really support that and appreciate any feedback you might have. So we are also going to highlight our 5th strategic direction, celebrating success in champions. Again, this is something that we've covered on previous webinars, but really wanted to provide the opportunity for you all to hear about where we're sitting with this initiative. So as part of that initiative, this is the first one that actually has a concrete action associated with it. So we launched the Climate and Health Champions Recognition Program, again, back in January of 2018, around the time that our website became available. It is available here. This is what the website looks like. There's information about what we're aiming to achieve with the recognition program, as well as an overview of it, and the criteria for nominating someone for this program. There are 4 types of awards for youth, individuals, businesses, or organizations. Again, there are criteria associated with each of these, which are listed. Some of them are listed here, more are listed on our website. We are accepting nominations until the end of March. So if you or someone you're aware of is doing a lot of great work here within Maricopa County across the spectrum of climate and health related topics, please consider nominating them. We would really like to see a lot of these great initiatives highlighted, and we would like to also just become more aware of all the great work that is being done. We also envision this strategic direction evolving. So right now we have the climate recognition program, but we anticipate that there will be further opportunities to celebrate those successes of the rest of our work from the other strategic directions in the future. So we also see this strategic direction evolving. It also has an action team lead and co-lead, Jessica Bell and Bielsa Barisha here at the County Health Department. If you're interested in being a part of this initiative, please also contact that email address and we can certainly get you involved in that action team, which will be meeting along with the others in the very near future. So overall, for the whole strategic plan, what is next? We have a draft strategic plan, which I said was in review. So hopefully we'll be able to distribute that to you all very shortly for your comment. We had originally anticipated getting it out within the last few days. That has not happened. So we will be extending that time period for feedback from you all. But we really would like to have that draft ready to go once the action teams begin to meet in about a month or so. So if you could keep an eye out for that, and then really, again, it's meant to be a draft. It will be something that evolves over time. So feel free to provide your feedback as you see fit. We would really like for this to be a coalition-driven process, and we would really welcome any sort of comments, feedback, and suggestions once you receive that draft. As I mentioned, this is the 4th of our webinars. The first 2 have been recorded and posted on our Climate and Health website. The last 2 will be posted at the end of the day today. So please feel free to forward those to members that were not able to attend today, coworkers that have not been previously involved in this initiative, or other organizations that you feel like would bring a very valuable perspective on the work that we've been discussing throughout these 5 strategic directions. We also plan to host another in-person Bridging Climate Change and Public Health meeting once the action teams have been meeting for a while and have some progress to discuss with the larger stakeholder group. So please stay tuned for that as well. Again, if you have any comments on any of these webinars, on the strategic directions that we've been talking about, or on the plan once it's distributed, please feel free to get in touch with any of us. If you would like to sign up for an action team, you can email us here at this generic email box and we can get it to the right person, or you can always contact those action team leads directly. I will then turn it back over to you all and see if there are any other questions on the lines, comments, or thoughts. Okay, well, David, thank you so much for describing your strategic direction today. We'll stay on the line for a little while people maybe have a chance to think more about the strategic direction. I will move back and go to the action team leads. There we go. If you, again, want to sign up for any of those action teams, please feel free to contact us or the action team leads listed here. And again, we'll stay on the line in case people want to think about questions or if you have further comments. Okay, David, I think you did such an amazing job that we don't have any questions on the line. So we'll go ahead and close out the webinar now.
Okay, well, thanks, Kate, and yeah, thanks. Perhaps it was your amazing job that satisfied all the potential question askers.
Well, thank you for that. And if anyone's still on the line and would like to join our team, we would really appreciate it. So thank you all for your time today, and we will talk again soon.
Bye, Kate. Thank you.